Let me ask you something, and I want you to be honest with yourself as you answer it. Have you ever felt like your body changed after 60 and you just didn't get the same instruction manual for the new version? Maybe intimacy started feeling different. Maybe pleasure felt harder to reach. Maybe you've heard about the G-spot your whole life but never quite figured it out. Or maybe you did figure it out once, years ago, and now it just doesn't seem to respond the same way. You're not alone. And more importantly, you are not broken. I'm Dr. Lila Romano, and in the next 21 minutes, I am going to walk you through everything you need to know about the G-spot after 60. The anatomy, the science, the hormonal changes, the practical techniques, the emotional side of it, all of it. No shame, no fluff, just honest, evidence-based information that you deserve to have. So stay with me, because what I'm about to share could genuinely change your intimate life. Like this video if you want more honest health conversations like this one. Subscribe and hit the bell. I post every week and you don't want to miss what's coming. Comment below. Tell me your age or your biggest question. I read every single one. Welcome back. I'm Dr. Lila Romano, urologist and women's health specialist, and this channel exists for one reason, because women deserve honest, science-backed answers about their own bodies. No shame, no confusion, no leaving the room with more questions than you came in with. Today's topic comes straight from my patients, women who lean across my desk and whisper, "Dr. Romano, does the G-spot even work after menopause? Am I too old for this?" And my answer is always the same. No, you are not too old. Your body is still capable. Let me show you exactly why. All right, let's get into the science. Let's start at the very beginning, because I want to make sure we're all on the same page, and because there's actually a lot of misinformation out there about this topic. The term G-spot was popularized in the 1980s, named after German gynecologist Ernst Grafenberg, who in the 1950s described a sensitive area along the anterior, meaning the front, wall of the vagina. For decades, there was enormous debate in the scientific community about whether the G-spot was a distinct anatomical structure or just a region of heightened sensitivity. Here's where the science has landed, and it's actually more interesting than the old debate. What we now understand is that the G-spot is not a separate organ floating inside you. It is a region. Specifically, it corresponds to the internal roots of the clitoris, combined with the Skene's glands, the urethral sponge, and an interconnected network of highly sensitive nerve endings. Some researchers now call this the CUV zone, the clitoral urethral vaginal complex. In other words, the G-spot is the place where the internal clitoris, which, by the way, is much larger than most people realize, interfaces with the anterior vaginal wall. Now let me explain the clitoral anatomy, because this is something women often aren't taught, and it completely changes everything. Most people think of the clitoris as just the small external button, the glans, at the top of the vulva. But that is only the tip. The actual clitoris is a wishbone-shaped structure that extends several inches inside the body. It has a body, a shaft, and two legs called crura that wrap around the vaginal canal and the urethra. It also has two vestibular bulbs that sit alongside the vaginal walls. When the clitoris is aroused and engorged with blood, those internal structures press against the anterior vaginal wall. That is what creates the G-spot sensation. It's not a magic button that lives independent of everything else. It's the fingerprint of your internal clitoral anatomy, making itself known through the vaginal wall. This is important for two reasons. First, it means the G-spot is real. Absolutely real. Some people feel it strongly, some feel it subtly, some need more stimulation to activate it. Antastos taktisamur ashansai, int mastikinsrans tashans, andashansai, but the anatomy is there. Second, it means understanding arousal is critical. If you try to stimulate the G-spot without adequate arousal, the clitoral tissue hasn't engorged yet, and you may feel little to nothing or even discomfort. The tissue needs to be awake, so to speak, before you go looking. I'll come back to this in the technique section, because it's one of the most common mistakes women over 60 make, not because they're doing anything wrong, but because no one ever explained the physiology to them. Where's the G-spot exactly? On average, it's located about 2 to 3 inches inside the vagina, along the front wall, the wall closest to your belly button, not your spine. When you're aroused, that area may feel slightly textured or ridged, almost like the roof of your mouth near the front. That difference in texture from the surrounding smooth tissue is a clue that you found the right area. What changes after 60? The hormonal and physical reality. Now, here is where the conversation gets really important and really personal. After menopause, your body goes through a series of changes that are driven primarily by the dramatic decrease in estrogen. And these changes affect exactly the tissues we've been talking about. Let me walk you through them clearly, because understanding why your body is behaving differently is the first step toward addressing it. Change number 1, vaginal atrophy, now more accurately called genitourinary syndrome of menopause, or GSM. Without estrogen, the vaginal tissues become thinner, less elastic, and less lubricated. The vaginal walls that used to be thick and cushioned become more delicate. The tissue that surrounds and overlies the G-spot region, that anterior vaginal wall, is affected too. This can mean 2 things. In some women, the G-spot becomes harder to locate because the tissue doesn't swell and differentiate the way it used to. In other women, the area may become more sensitive, almost hypersensitive, because the thinning tissue means nerve endings are closer to the surface. So when a woman over 60 says it doesn't feel the same, she is physiologically correct. It doesn't. But different does not mean gone. Change number 2, reduced natural lubrication. Estrogen supports the Bartholin's glands and the vaginal mucosa in producing lubrication. After menopause, that process slows significantly. Without lubrication, stimulation that used to feel pleasurable can feel uncomfortable or even irritating. This is not a psychological issue. It's a physical one, and it's completely addressable. Change number 3, longer arousal time. This is the one I wish more women were told explicitly. After 60, the vascular response, meaning how quickly blood flows to the genitals during arousal, slows down. It's the same principle as a man needing more time to achieve and maintain an erection. Your body isn't broken, it just needs more runway. The clitoral engorgement that I described earlier, the engorgement that makes G-spot stimulation possible and pleasurable, still happens. It just takes longer. Rushing it is the number 1 reason G-spot stimulation doesn't work well after menopause. Change number 4, pelvic floor changes. The pelvic floor muscles, which support the vagina, uterus, bladder, and rectum, can weaken after menopause. These muscles also play a role in sexual sensation. If they're very lax, the tighter, more supported environment that allows for G-spot pressure and response may be less present. If they're very tense, which is also common after menopause, sometimes as a protective response, penetration and internal stimulation can cause discomfort. Change number 5, psychological and contextual factors. I'd be doing you a disservice if I didn't mention this. After 60, many women are navigating body image changes, shifts in partnership dynamics, health concerns, medications with sexual side effects, antidepressants, blood pressure medications, antihistamines all affect lubrication and sensation, and sometimes just years of accumulated sexual habits that haven't been examined or updated. Your brain is your most powerful sexual organ. I mean that completely seriously. The mental and emotional context of intimacy after 60 matters enormously. None of these changes are a sentence. Every single one of them is workable. Preparing your body, what to do before you even try. This section might be the most important practical advice I give you today, so I want you to really listen. The reason most women, at any age, but especially after 60, don't have success with G-spot stimulation is not technique. It's preparation. It's the failure to understand that the G-spot is the destination and arousal is the vehicle. You cannot get there without the vehicle. So here is what preparation looks like. Step 1. Address vaginal dryness medically if it's significant. If you are experiencing GSM, the vaginal atrophy I described, please talk to your doctor. There are excellent options. Local vaginal estrogen, which comes in very low doses as a cream, ring, or suppository, directly restores vaginal tissue health with minimal systemic absorption. There are also non-hormonal options like ospemifene, a selective estrogen receptor modulator, and hyaluronic acid vaginal moisturizers that have good evidence behind them. Do not just white-knuckle through dryness and discomfort. That will train your nervous system to associate intimacy with pain, and that's a much harder problem to undo. Step 2. Use lubricants every single time. Generously. This is non-negotiable after 60. I tell my patients, lubricant is not a sign that something is wrong with you. It is the physiologically intelligent adaptation to a body that has changed. Use a quality silicone-based lubricant for longer-lasting glide if you're using fingers or a toy, or a water-based lubricant if you're using a silicone toy. Avoid anything with glycerin, fragrance, or warming, cooling agents. These can irritate delicate postmenopausal tissue. Step 3. Invest time in full-body arousal before any internal stimulation. I recommend a minimum of 15 to 20 minutes of non-genital and then external genital stimulation before any attempt at G-spot stimulation. I know that sounds like a long time if you're used to a different pace. But this is your body's timeline now, and working with it instead of against it makes everything more pleasurable. What does this look like? Sensual touch, massage, kissing, skin contact that you find pleasurable, external clitoral stimulation, allowing yourself to become genuinely, deeply aroused before any internal exploration. Think of it this way, you wouldn't try to find a specific destination in a city you've never visited without turning on the navigation first. Arousal is your navigation system. Turn it on first. Step 4. Empty your bladder beforehand. This is practical but important. The G-spot sits adjacent to the urethra and the bladder. When you stimulate the G-spot, especially if you do so successfully, it can create a sensation that feels like you need to urinate. This is completely normal, and for most women, it transforms into intense pleasure if they relax through it. But if your bladder is full, that sensation will be uncomfortable and distracting. Empty it first. Step 5. Create the right context. Private, unhurried time. Warmth. Literally, physical warmth, because cold muscles and cold tissue don't respond as well. Low lights, if that helps you relax. Whatever allows your nervous system to shift out of everyday alert mode. Sexual arousal requires the parasympathetic nervous system, the rest and digest, safe and connected branch. Stress and rushing activate the sympathetic nervous system, fight or flight, which actively suppresses arousal. So, creating a genuinely relaxed environment is physiology, not luxury. Satorwats? Ya. The technique, step by step. All right, this is the practical section. I'm going to walk you through this clearly and specifically. Whether you are exploring solo or with a partner, the principles are the same. First, positioning. The most effective position for G-spot stimulation gives you or your partner access to the anterior vaginal wall. Remember, the front wall toward the belly button. For solo exploration, lying on your back with your hips slightly elevated, a pillow under your lower back can help, gives your fingers access at the right angle. Some women find it easier sitting up slightly, almost in a semi-reclined position. For partnered stimulation with fingers, the partner can be positioned between your legs or to your side, facing you. For penetrative sex, positions where the angle of entry tilts toward the anterior wall work best. This includes the woman on top, facing forward, which gives the most direct control over angle and pressure, and rear entry positions with the receiver's hips tilted upward. Now, technique specifically. After you are genuinely aroused, and I mean genuinely, not just adequately, use 1 or 2 well-lubricated fingers inserted vaginally, palm facing upward. Curl your fingers in a come-hither motion toward the front wall of the vagina. You're looking for an area approximately 2 to 3 inches in, sometimes a bit deeper in some women, that has a slightly different texture, often described as ridged or spongy compared to the smoother surrounding tissue. Once you locate that area, the stimulation technique is not thrusting. That's a common misconception. The most effective G-spot stimulation is rhythmic pressure, a firm, consistent, come-hither motion, pressing up and slightly forward. Some women prefer a gentle tapping motion. Some prefer circular pressure. The key is experimenting with what produces that deep internal sensation, which is different from external clitoral sensation. It's fuller, more pressure-based, sometimes almost like a deep ache that builds. Pressure matters. The G-spot generally responds to firmer pressure than the external clitoris. Don't be tentative. Start with moderate pressure and increase gradually. The tissue is thicker here, and the nerve response requires more input, simultaneous stimulation. For the vast majority of women, and this is true at any age but especially after 60, combining G-spot stimulation with external clitoral stimulation is significantly more pleasurable and more likely to lead to orgasm than G-spot stimulation alone. Use your thumb on the clitoris while your fingers are inside, or use a small external vibrator simultaneously. This dual stimulation engages both the external and internal portions of the clitoral complex at the same time, and the combined response is substantially more powerful. Curved toys. If manual dexterity is a challenge, and after 60, arthritis, hand strength, and reach can all be genuine obstacles, a G-spot specific vibrator is an excellent tool. These are designed with a curve specifically to reach the anterior vaginal wall without awkward wrist angles. Look for one with multiple vibration settings because the type of stimulation that works varies by individual and may change based on your arousal level. What to expect? The initial sensation when you locate and stimulate the G-spot may be that urge to urinate feeling I mentioned. Breathe. Relax. Don't tense up. If you've already emptied your bladder, you know it's not an actual bladder signal. Allow the sensation to build. For some women, particularly those who haven't focused here in a while, it may take several sessions before the full response develops. The tissue, like any responsive tissue, can become more sensitive with regular attention. For women experiencing some discomfort, if internal stimulation is uncomfortable rather than pleasurable, even after thorough arousal and lubrication, please don't push through pain. Pain is your body's signal. It may mean you need more time on arousal. It may mean you have GSM that needs treatment. It may mean pelvic floor tension that a pelvic floor physiotherapist, yes, this is a real and wonderful specialty, can help address. Pain is information, not a failure. The emotional and relational side. I want to spend a few minutes here because I believe this is just as important as any technique I've described. For many women over 60, exploring sexuality, especially exploring it in new or re-examined ways, comes with a weight of complicated feelings. There may be grief for a body that responded differently at 35. There may be embarrassment about not having figured this out earlier. There may be relationship dynamics where partners have their own changes and uncertainties. There may be internalized messages from a culture that has told women, particularly older women, that their sexuality is less relevant, less interesting, or less deserving of attention. I want to name all of that, and then I want to gently and firmly push back against it. Your sexuality does not have an expiration date. Your body's capacity for pleasure does not expire at 60 or 70 or 80. It changes significantly in ways that require adaptation, but it does not disappear unless you stop paying attention to it. And in fact, many of my patients tell me that their intimate lives after 60, once they understand the changes and adapt to them, are actually more satisfying than before. Why? Because they've stopped performing, they've stopped hurrying, they've let go of the anxiety of earlier decades. They've become better communicators. They know themselves better. They have more patience and self-compassion, most of the time. If you're in a partnership, this is a conversation worth having. Not a clinical debrief, but an honest, curious conversation about what feels good now, what's changed, what you'd like to explore. Partners who are willing to go on that journey with you, to slow down, to learn, to adapt, those are the conversations that deepen intimacy in ways that go far beyond the physical. And if you're exploring solo, which is completely legitimate, completely healthy, and something I actively encourage for all my patients as part of knowing their own bodies, that self-exploration is not a consolation prize. It is a genuine, valuable form of self-connection and self-care. Please give yourself permission to prioritize this, not because society says you should be sexual, but because you deserve to know your own body. You deserve pleasure. Full stop. Practical summary and quick tips. Let me give you a quick summary of everything we've covered so you leave this video with a clear roadmap. 1. The G-spot is real. It's the anterior vaginal area corresponding to the internal clitoral complex. Its response depends heavily on arousal and adequate blood flow to those tissues. 2. After 60, hormonal changes, primarily the drop in estrogen, affect tissue thickness, lubrication, and arousal speed. These are real changes that require real adaptations, not just willpower. 3. Address any vaginal dryness or atrophy medically. Talk to your doctor. There are effective options. Don't suffer in silence. 4. Preparation is everything. More arousal time, quality lubricant, relaxed environment, empty bladder. 5. The technique is firm, rhythmic, anterior wall-targeted pressure with a come-hither motion. Combine with external clitoral stimulation for best results. Curved vibrators are a legitimate and practical tool. 6. If there's pain, don't push through it. Get it evaluated. Pelvic floor physiotherapy is a remarkable resource. 7. The emotional and relational context matters enormously. Give yourself permission to prioritize your pleasure and to have honest conversations with partners. 8. This takes practice. Be patient with your body. It is not broken. It is evolving, and so are you. Before I let you go, I want to say something directly to you. You showed up for this video. You sought out this information. You took your own well-being seriously enough to spend 21 minutes learning something that most women are never taught. Not in school, not in doctors' offices, not anywhere. That takes a quiet kind of courage, and I want you to take what you learned here and do something with it. Not because you have to perform a certain way or achieve a certain outcome or match anyone else's experience, but because you deserve a relationship with your own body that is informed, curious, and kind. Your body has carried you for 6 decades or more. It has been through everything with you. It deserves your attention and your care, including the kind of care that involves pleasure, intimacy, and joy. You are not past your prime. You are not too old for this conversation. You are exactly where you're supposed to be. And with the right information, the next chapter of your intimate life can be as rich and satisfying as any that came before. If this video helped you, please hit that like button right now. It takes 2 seconds, and it helps this content reach other women who are sitting with the same quiet questions you had when you started watching. Subscribe to the channel so you don't miss what's coming next. I have videos planned on pelvic floor health, navigating low libido after menopause, how to talk to your doctor about sexual health, and much more. And leave me a comment below. Tell me what you found most helpful, or tell me what you want me to cover next. I read every comment, and your questions genuinely shape what I make for you. I'm Dr. Lila Romano. Take care of yourselves, all of yourselves, and I'll see you in the next video.